Have you ever been going about your day, feeling perfectly fine? And then suddenly, a strange new pain appears in your belly? It's a feeling that stops you in your tracks. You start to wonder, is this just something I ate? Is it a bad case of gas? Or could it be something more serious? This kind of sudden, unfamiliar abdominal pain can be worrying, sending your mind racing through possibilities. It's common to feel a little lost and concerned, unsure what your body is trying to say. Take a breath. This uncertainty is normal. Most belly aches are temporary and harmless, indigestion, stress, or a mild bug. But some pains are warning signals, and one we should know is appendicitis. Today we'll gently walk through the signs in simple steps. Think of this as a friendly guide to demystify a common issue. We'll replace confusion with clarity, anxiety with awareness. Imagine your large intestine. At its beginning, a tiny tube pokes out. That's the appendix. About 2 to 4 inches long, tucked in the lower right abdomen. It may support immunity and store helpful gut bacteria, but when blocked, bacteria multiply, pressure builds, and the appendix inflames. Untreated, it can burst, a true emergency. So how can you tell a regular ache from appendicitis? Watch how the pain develops over hours. It often starts as a dull, vague ache near the belly button. Over 6 to 12 hours, it migrates to the lower right. Then it becomes sharp, constant, and localized. Often you can point to it with one finger. Other clues: loss of appetite, nausea or vomiting, and a low-grade fever. Typically around 99 to 101 degrees Fahrenheit. Movement can worsen it, and pressing, then releasing the spot spikes pain. Rebound tenderness. Appendicitis can affect anyone. Not everyone has all symptoms, especially young children or older adults. For centuries, this illness was a deadly mystery. In 1735, British surgeon Claudius Amiand performed the first successful appendectomy. He found an inflamed appendix perforated by a pin and removed it, remarkable for its time. In 1886, Dr. Reginald Fitz named the condition appendicitis and urged early surgery. A famous first. In 1961, Russian doctor Leonid Rogossov diagnosed his own appendicitis and performed a self-appendectomy in Antarctica. If you notice these signs, seek care promptly. Your visit starts with questions about when the pain began, where it is, and how it feels. A careful exam checks for tenderness, guarding, and rebound tenderness. Blood tests often show a higher white blood cell count, evidence of infection. Ultrasound is common, especially for kids and during pregnancy. A CT scan can clearly show an inflamed appendix when needed. If appendicitis is confirmed, the usual treatment is surgery, an appendectomy. Most are minimally invasive, using tiny incisions and a camera. The appendix is removed safely without a large cut. Recovery is faster, pain is usually less, and scars are smaller. Thanks to modern care, what was once deadly is now routinely cured. Thank you for learning with me today. Please subscribe to Aiken's YouTube channel to be informed when new videos drop. See you in my next video. Stay healthy and stay safe.